I see psychiatry as inherently part of patriarchy. So to me, there is a necessary relationship between the two. That this is a rule of the fathers, you know, and very much at the expense of women. And I'm not saying men are treated badly. In fact, men are treated the way women are often treated. You know, though women are treated worse. And that women essentially are a diagnosis. And essentially, people are seeing being women as being disordered, and you could see that in all sorts of ways. And women were disordered if they acted like women. Women were disordered if they didn't act like women. There was this narrow little ground in which women could stand, and not one that was good for them. So to me, and we also had, you know, we also had a profession that was, besides curtailing people's freedom, was locking them up, was turning them into a drug addict, you know, the worst kind of drug addict, people who have to take drugs 3 times a day, you know, multi-drugs. And, you know, I think people would have done, you know, if they'd had their drug of choice, would have done a whole lot better than these drugs. And so to me, this was, and we saw a profession that particularly preyed on women. So, you know, that with, you know, electroshock has always stood out to me as the epitome of this, where in every jurisdiction and in every era where electroshock has been given, 2 to 3 times as many women as men are given it, despite the fact that women are more brain damaged by it, despite the fact, et cetera, and where it's now the treatment of choice for postpartum depression. So when I look at those things, these to me are like basic feminist issues. So when and to me that alliance is needed because we need this, you know, psychiatry not having this kind of hegemonic control over people and state control over people to have a better world. And the feminist movement is the best situated movement to really move that agenda. You know, and when I'm saying that, I'm not saying the psych survivor movement isn't critical, these other movements are critical, but this is the movement with the numbers, and this is the gender that is particularly pathologized.